and so it should be hopefully relatively quick. And from a, I think, standpoint for the children, I think it'll be helpful every little bit that we can get every time. The sooner we can get it, the better.
Well, and it's not, we've always said, it's not just having the vaccine available, it's actually getting the vaccine into your body. So children now account for 1 in 5 cases. That's a lot to hear that. Why is it so important that kids get the vaccine and parents understand that?
I think it's so important because, we're seeing different patterns with, especially with Delta kind of taking over as the predominant strain. We're now seeing a lot of these things affecting children. And it's not just acute COVID. We're seeing the kids with acute COVID being in the hospital, but we're also seeing MIS-C, which we don't really see, yes, there is kind of multi-system inflammatory syndrome in adults, but really this is something that affects kids. So 4 to 6 weeks after being affected by COVID or being exposed to COVID, they're having this vast inflammatory response that's happening. So that has to be looked at. And then we also have a lot of teenagers and adolescents that are having long COVID syndromes or symptoms that need to be looked at. So getting that extra
Good morning. It is Thursday, September 23rd. We are going to get to the COVID numbers here in just a moment. But first, we have some order of business that we need to talk about. We know that many of you have been experiencing some difficulties with the feed the past couple of days. We just want you to hang in there. We are working through this, but we need to hear from you. We need your help. So what we want you to do is try updating your iPhone. If you've done that, it's still not working, we want to hear from you. Put it in the feed. Or if you are on another device and still having trouble, we want to hear from you. Our Facebook connection is strong. We just need your help troubleshooting what these issues are right now. However, you can still send in your questions. We are getting those, and we will ask those, and then you can go back and watch the broadcast on Facebook, on our podcast, and you can also find us on YouTube. So let us know. And right now, we want to get to some good stuff today. We got a lot of fun stuff going on today. We are following along on an incredible journey. We catch up with a few of the riders cycling all the way from Colorado to Kansas City. They are raising money for Coast to Coast for cancer. And we're going to talk about why they made this grueling trip, this big task to make a difference for so many people touched with cancer. So we're going to catch up with some of those bikers. We got some incredible stories coming up. But first, we want to get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our numbers. How did we do overnight?
Yeah, we're still holding steady in that mid-30s to low 40s number. Went down just a little bit. We should note that our last death was on September 20th, and that patient was not vaccinated. Currently, we have 35 active infections with 13 patients in the ICU and 9 on the ventilator. There's an additional 37 patients